Elizabeth again. Today we're really no script. I just want to stop by, just want to say hello. I know that in the US, the COVID strain 19 are spiking again, and people are still getting sick, still, suffering. Is it was danger just like before? No, but it's still going. People still catching the COVID-19 strain. I am speaking as the nurse. For those who don't know, Elise is a registered nurse. My colleagues, nurses and doctors are still treating and help fighting COVID-19 patients in the hospital. They are still working really hard, trying to treat and save life for those still contact the COVID-19 strain. As we know, that is a dangerous strain, and a lot of people did lost life all throughout the world. And Elizabeth just want to be here, represent my colleagues, co-nurses and doctor. If we could just be careful and be caring by still wearing your mask and wash your hand wherever you go, you still need to be precautions. And if you're able to do that, you can save a lot of people like yourself, your family, and giving a colleague of mine, the nurses and doctor, a break in our emergency room, in our ICU, or special units who we have, like in the US, they make a special unit just for the COVID-19 strain. So if we all can take precautions and be caring what we are doing, and we will minimize the number of COVID-19 strain patients. It is our responsibility to do that. It's not a virus itself. It is our job. Also, Elizabeth wants to remind us that during this difficult time, anything that we don't need in our life, do we really need it? This is the time that we need to just say, these items in life, these things in life, maybe we don't need it. What we need right now is our health, so we can continue to be here, be happy with our family. Elizabeth just want to also ask if you would be caring, be patient with people that you know, with people that you love. This is the time that we need to be there for other people. Be caring, be loving, be sympathetic. A lot of us during COVID-19 strain, we lost our job. For who those lost their job, they're gone through this difficult time. They don't have money to pay their mortgage. They don't have money to pay for food for their family. So this is the time that we need to reach out and be caring, be supportive for people that lost their job or elderly who don't have someone to be there for them. Also, Elizabeth wants to ask if we are still be caring, wearing masks, washing our hands, be quarantined and be safe and be staying at home. Don't need to be going out there to wandering around. This is a time that we can help. If we can still doing masks and wash your hand for the next 4 to 6 weeks, this disease will be minimized or going down. I believe it's not a disease itself. it's a person, it's us that we responsible to minimize, to decrease this COVID-19 symptoms. So perhaps maybe our world can go back to at least a normal little bit. It is our responsibility. It is our job to do so. Elizabeth just want to be here to remind us that during this time of crisis, we don't need a lot of things in our life. We don't need new clothes. We don't need a new haircut. We don't need a new nails. We don't need a new eyelashes. Perhaps we need to just stay put at home. Spend time with your family. This is the time that this is our precious time that you can see eye to eyes with your loved ones at home. The conversation, you can need a conversation eye to eyes. But most of the time now that we are so busy, you send a text out, you don't know this is gonna hurt someone's feeling, or this is a good conversations. This is the time that you just need to minimize those use. Sit at home, eye to eyes conversation. This is what our world need now. Eye to eye conversation, it lost many years ago when the cell phone came out. So now is the time. Stay home,